children placed by the state and then left to die earlier. An opinion article on foster care, residential care, HVB, and shortened life expectancy. There are statistics that disturb. Statistics that do not merely describe reality, but expose it. Statistics that should shake an entire society. Children placed in foster homes and residential care live shorter lives than other children. Not symbolically, not figuratively, but statistically, medically, and socially demonstrable. This is not a matter of emotion. It is a matter of life expectancy. And we are talking about children for whom the state has assumed responsibility. The state takes the children, but fails to protect their lives. When a child is placed in care, the state makes one of the most invasive decisions possible. It takes over parenthood. The justification is always the same: the best interest of the child. But if that were truly achieved, research would not show what it does. Children and young people who have been in out-of-home care experience significantly increased mortality in childhood and youth, sharply elevated mortality in young adulthood, substantially shorter life expectancy compared to the general population. This has been repeatedly demonstrated in Swedish, Nordic, and international research. These are not minor differences. This is a life gap. Shortened life expectancy, a silent public health crisis. When researchers follow individuals with a history of out-of-home care across the life course, a clear pattern emerges. Elevated mortality across the lifespan. The risks do not end when placement ends. They follow the individual into adulthood. The increased mortality is particularly visible in the age ranges: 18-25 years, 25-35 years, 35-50 years. These are the years when others pursue education, build families, establish careers. For many formerly placed children, these are instead the years of greatest risk of dying. A life that often ends 10-20 years earlier. Nordic and international studies consistently show individuals with experience of out-of-home care have, on average, 10-20 years shorter life expectancy. This does not mean no one grows old. It means fewer people reach old age. More die. Before age 50. Before retirement. Before they have had time to live the life the state promised to protect. This is not an individual failure. It is a systemic one. Why do they die earlier? Research identifies recurring causes. 1. Suicide and severe mental illness. Formerly placed individuals face elevated risk of depression, PTSD, self-harm, suicide. Suicide is one of the leading contributors to excess mortality. 2. Substance use and addiction. Higher prevalence of alcohol dependency, drug misuse, overdose. Addiction is both a consequence of early trauma and a direct mortality risk. 3. Accidents and violence. Increased mortality linked to traffic accidents, violent crime, high-risk behaviors, often associated with trauma exposure and unstable life transitions. 4. Sexual abuse and exploitation. Research shows elevated exposure to sexual abuse, exploitation,
intimate partner violence.
Early trauma becomes a lifelong risk factor. The most dangerous moment when support ends. One of the most critical turning points is when placement ends. At ages 18-21, many lose financial support, stable adults, Structured daily life. At exactly the age when mortality spikes, society withdraws and risks escalate. The moral question we avoid. We must ask, how can children taken into state protection experience worse life outcomes than others? When society intervenes, we say, we are protecting the child. But statistics whisper something else. We are not protecting them long enough. What must change? Lifelong follow-up. Strong, trauma-informed mental health services. Guaranteed transition support into adulthood. National strategy addressing excess mortality among care leavers. Final words. The children placed in care are society's responsibility. Not temporarily, not administratively, but morally and across the lifespan. If the children we protect die earlier than others, we must confront that truth and act now.